Pediatricians are seeing an alarming rise in cases of a mysterious inflammatory illness in children, and there's hopeful news about new developments in a vaccine for COVID-19.
Joining us now to break it all down and give us his perspective on these topics, Dr. Nicholas Testa, Chief Medical Officer with Dignity Health, Southern California. Once this is all over, Dr. Testa, we're getting you an office here, just because.
An office and a parking space.
Okay, yeah, there you go.
With your name on it.
So good morning to you, but can you explain more about this inflammatory condition that doctors are seeing in kids? Is that a mutation of the coronavirus, or is it just another piece of the puzzle?
Sure. I think another piece of the puzzle is a better descriptor. So it's called multisystem inflammatory syndrome in children. And it looks like another disease. It looks like a disease called Kawasaki's disease, which is very rare and is an inflammatory autoimmune response. All of a sudden, we started seeing this increasing numbers of Kawasaki's disease, and that didn't quite make sense. So when we went back and did serological testing on the kids, they were seeing that they had the antibodies for COVID-19 or the coronavirus. So they're making this link to say the infection with COVID-19 is actually causing an autoimmune response that's mimicking this disease. It's like Kawasaki's disease.
Wow. So we're hearing promising news coming from a pharmaceutical company called Moderna about a vaccine for COVID-19. Can you tell us anything about that?
Yeah, so, this is one of many updates we're going to hear about vaccines because there's such a spotlight on, is there going to be a vaccine in the near future? Moderna did release a press release that they had 8 patients in their trial that showed that they were able to generate antibodies to the coronavirus, which is great, but it is only one small step forward. There's a lot of things we need to keep in remember. Moderna released a press release, which is for the press, right? But they did not release their data yet. So really nobody's been able to scrutinize how far have they really gotten. So once again, Moderna has made probably another small step forward in the journey towards getting a vaccine, but this is not going to be one single jump where all of a sudden we have a vaccine. This is going to be a whole myriad of small steps that many of us never really saw before, but now we're becoming privileged to.
Does it matter? You said that these 8 people show the antibodies developed. We don't even necessarily know if we have immunity to it yet. So is that part of the puzzle you're talking about?
100%. Just because you have the antibodies, and what they showed was they had the antibodies at 2 weeks. We don't know what an immune person's antibody profile looks like. So just because you have the antibodies, we don't know if that confers immunity. And then we also don't know if it's durable, right? So you have the antibodies at 2 weeks. What are those patients going to look like 2 months from now or 2 years from now?
Yeah. So let's talk about hydroxychloroquine, its use, and the president's decision to take the medication. Are there serious side effects?
So, with hydroxychloroquine, there are side effects. It's a drug that has known cardiac side effects. So the decision to take it in for prophylaxis for coronavirus is really not supported in the literature, and clinically, we're not doing it. Where the side effect, though, really is that hydroxychloroquine is a great drug for treating a certain subset of diseases, particularly lupus. And what we're seeing is that so many people are trying to get their hands on hydroxychloroquine or hoard hydroxychloroquine that we have lupus patients out there who can't get the drug that they need. So the side effect, yes, you could have some cardiac arrhythmias, but the side effect is that the people who need the drug, who get treated with it every day, are having a hard time getting it.
And that's a serious side effect. I mean, for anyone that knows somebody with lupus, it's debilitating if you can't treat it
100%.
properly. Okay.
Yeah, 100%.
Dr. Testa, thank you very much. Thanks for joining us this morning, and we will see you hopefully very soon.
Have a great day.